Okay, everyone. So thank you so much for those of us that have been waiting to get started. I'm really excited to be here with Andrea. This is a super huge topic, so I'm really excited to share with everyone today. Um, and and as we get started, I am going to share this screen right now um, for our webinar. So let's just see. So we're going to be talking about how to heal from anxiety and depression. My name is Amanda Greenthumb, and I'm joined by Andrea Widerick, and we are really excited to talk about this. But before we get into any of our coping strategies or food suggestions, I did just want to bring to attention that obviously in our 1 hour webinar, we aren't going to be healing anyone's anxiety and depression, and that's not the point of this webinar. This point is to give you a certain set of skills that you can use at home and throughout the rest of your life to ease your symptoms and to really get some relief. So that's our focus of today's call, and I'm really excited. So let me introduce Andrea. Andrea is a registered psychotherapist currently practicing primary care and private practice in Ontario. Andrea is trained in cognitive behavioral therapy and dialectical behavioral therapy and specializes in the treatment of anxious and depressed mood and healthy coping skill development. Andrea regularly discusses the mind-body connection to treatment with her patients and the importance of wellness of both body and mind. My name is Amanda Greenthumb, as I said. I am a mom certified health coach and blogger at amandagreenthumb.com. I coach busy moms who are struggling to find their love in their bodies and find balance. So I really help them to master the art of letting go, get mega doses of nutrition into their hectic lives, treat themselves with gratitude, and fall in love with their true self, all to feel balanced and beautiful permanently. So I'll just give you a little overview and then I'll be passing the call over to Andrea to get us started. So on today's call, we're going to be talking about what is mental health. Andrea is going to dive into anxiety and depression. She'll be talking about interventions, coping strategies, mindfulness. I'll be talking about nutrition and mental health, what foods to avoid, and the best foods for anxiety and depression. If you have any questions, please save them to the end. And when we're done this presentation, we're going to open it up and everyone will be able to ask any questions that they want. So be mindful also of your breathing and your background on the call. This webinar is being recorded. And so we'd really greatly appreciate everyone to mute their line. I think if you call in, I think it's #6. I think that's how you mute it. So, and yeah, hopefully you enjoy our information in our webinar, and we look forward to hearing all of your questions at the end. So, Andrea, I'll hand the call over to you now.
Thank you, Amanda. Hello, everyone. Thank you for taking time out of your very busy schedules to join us this evening, and I'm very excited to be here. So I think a really good place for us to start off is talking a little bit more about the idea of what exactly is mental health. So on the slide in front of you here, I'm talking a little bit about mental health being the emotional as well as psychological well-being of an individual. And just like all individuals have their physical health, we all have our own mental health as well. And it's a very real presence. And mental health definitely does not discriminate based upon any factors, socioeconomic status, culture, occupation. It is something that affects each and every one of us. Although it is in my line of work, mental health diagnoses can be helpful so that we can have a greater understanding as far as symptoms and guidelines for treatment interventions. It's also very important to remember that healthy coping and healthy mental health happens at any age and any stage in your life. And healthy coping is something that any individual can benefit from with or without a formalized diagnosis. So what exactly is anxiety and depression? These are two words that I feel in society, in our culture, we hear all the time. But what exactly do these words mean? So we're going to talk a little bit more about the impact specifically on Canadians and how it can impact us directly as well as indirectly. So as you'll see, approximately 20% of Canadians will at some point in their life personally experience a mental illness. Mental illness affects people of all ages, education and income levels, and cultures. approximately 8% of individuals will experience major depression at some point in their lives, and anxiety disorders affect approximately 5% of the household population. So at any point in time in Canada, approximately 5% of individuals will have some form of a struggle with an anxiety disorder. What causes it? This is one of the most common questions that my patients will ask me. What we do know about mental health is that it is a complex interplay of genetic predispositions, biological influence, personality, and environmental factors. Almost half, or 49% of those people who feel they have suffered from depression or anxiety have never gone to see a doctor about this problem. And this is something that I see on a daily basis working in primary care or working in family medicine. Adults who come into my office and are reporting that they've had often a chronic struggle, but they've never sought support. And up until now, at this point in their life, they haven't been exactly sure what to do to help themselves or where to go from here. Stigma and discrimination is still quite prevalent when we think about mental health and mental illness. It's a serious barrier, not only for diagnosis and treatment, but also acceptance within the larger scale, the larger community. And most importantly, what I want all my patients to know, and anyone that I'm communicating with regarding mental health, is that mental illness can be treated effectively, and individuals don't have to suffer. And I think that that's an important fact that often goes forgotten. What exactly is anxiety? So generalized anxiety disorder is the excessive worry about a number of everyday problems for more than 6 months. Although it's very much normal to experience feelings of anxiousness or experience feelings of anxiety from time to time, anxiety is considered to be clinically significant when it begins to interfere with our ability to function or really to do the things we need to do each and every day. Often individuals may experience physical symptoms, also referred to as somatic complaints. Some of the symptoms, this is definitely not exhaustive, but some of the symptoms can be trouble sleeping, muscle tension, nausea, diarrhea, headaches, and backaches are just a few. Anxiety disorders can affect anyone at any age, and it is one of the most common mental health problems. Although an individual may not meet that clinical criteria, so even though a family physician or psychiatrist or some form of mental health specialist may not provide a diagnosis, developing healthy coping skills to better manage anxiety is something that every individual, child and adult alike, can absolutely benefit from. What exactly is depression? So depression is a mental illness that affects a person's mood, so specifically the way that that person tends to feel. Depression is more than simply having a quote-unquote bad day or feeling blue. Without supports like treatment, depression often can last for a significant amount of time. So this can last anywhere from several weeks to several years, depending upon each unique individual. Often an individual will experience symptoms such as sadness, feelings of worthlessness, hopelessness, guilt, or feeling guilty. Often they experience a lot of anxiousness too at the same time. Irritation and anger are also very common for individuals who are struggling with depression. With depression, what we also see is people tend to lose interest in things that they once enjoyed, and they might start to withdraw or pull back from other people, so that social isolation piece is often quite prevalent. Changes to focus and memory can also occur. It can be very difficult for an individual to concentrate, learn new things, or make decisions. Depression can also change the way people eat and sleep, and for many people, there's also they can experience physical health problems as well. Of course, the age and the sex of an individual can impact how people experience depression. Often what we see is males may experience greater rates of anger or irritation, whereas females tend to experience more rates of sadness. And that's how some of the characteristics might be manifested when I'm working with someone. So now that we have this brief overview of what exactly mental health is, what exactly is anxiety, what is depression, where do we go from here? How can we help to treat it? The most common intervention to date when we think about psychotherapy and we think about mental health treatment is cognitive behavioral therapy, or CBT. This is one of the most well-known and most researched psychotherapeutic interventions. What essentially happens is CBT will target the connection of thoughts, feelings, and behaviors, and it teaches individuals how they can change their feelings and actions by changing their thoughts. CBT encourages behavioral activation, so this is getting up and getting moving, such as regular physical exercise to assist in the regulation of low and anxious moods. Regular relaxation training is also included, which helps to calm the body and calm the mind. CBT also will target the occurrence of distorted thought patterns within an individual, because often a common struggle that many individuals will experience regardless of formalized diagnosis. So whether there's a formalized diagnosis of anxiety or depression, having some thought distortions about themselves or perceptions about other individuals or situations is actually quite common. So I go on here to talk a little bit more about how the perception can be influenced based upon how we're feeling. Individuals will learn through CBT how can they distinguish when our worries or our fears are talking within our mind, and how to challenge these thoughts with more realistic and accurate beliefs. Research has found that the application of CBT can result in the rewiring of the brain with regular and consistent use. This means that one's automatic thoughts, which often are influenced by that sadness, by that low mood, or by that worry or by that fear, can eventually become replaced and strengthened over time, allowing for a reduction in our emotional and behavioral symptoms associated with anxiety and depression. Another form of therapy that is actually one of the hottest therapies on the market right now is something called Dialectical Behavioral Therapy, or DBT. And DBT is founded in the practice of mindfulness-based skills. Originally, this treatment was developed to target the most high-risk and difficult-to-treat population of patients. Recent research is finding that the practice of mindfulness is helpful for a variety of struggles, including that of focus, attention, impulse control, ADHD, anxiousness and worries, low mood, suicidal ideation, self-harm ideation, interpersonal conflict, emotion regulation, substance use, disordered eating, and more. So with or without a formalized diagnosis, when we think about the idea of using mindfulness in our daily lives, this is absolutely something that the research is showing as being beneficial for multiple reasons. DBT focuses on the provision of modules that target specific areas in an individual's functioning, such as distress tolerance, or how well I can tolerate stressful events that are happening in my life. Emotion regulation, so what can I do to make myself the best or the most equipped to manage daily stressors. Interpersonal effectiveness, or my ability to communicate with other individuals and communicating my needs and being able to say no and not feeling bad about that. Walking the middle path of dialectical thinking, which means to see that life is not always black and white, that there is a large gray area and there can be two truths in every discussion, every conflict that we might be participating in. And of course, focusing on the core skill of being present focused or being mindful. DBT skills practice have been found to assist in the development of healthy coping. It can act as a really nice supplemental intervention that we would use with CBT when treating anxiety and depression, and many of my patients have found it to be very helpful for them. So where do we go from here? What are some practical coping strategies that you can take away from this webinar this evening? The first one that I cannot stress enough is self-care. This is the intentional practice of taking care of you. Self-care is a foundational component to any mental health-focused treatment. It is absolutely essential that we take steps practicing activities that we find pleasurable and enjoyable. Activities need not have a financial cost associated. Rather, most can be low cost, no cost, the better. Practicing self-care works to recharge our emotional batteries so that we are better equipped to manage or to cope with our daily stressors. Participation in self-care models to others, including our children and our families, that taking care of ourselves is important. Self-care can be 5 minutes in length. It can be half an hour. It can be an hour. The point is working that into our daily structure, our daily routine, is absolutely foundational for our own wellness. So when you think about how can I practice self-care, how can I introduce this every day into my life, you need to take a step back and figure out, all right, what is one thing that makes me feel good? So some of my patients that I've worked with, and myself included, talk about a hot bath, reading a chapter from a good book, half an hour of a favorite television show, enjoying your morning beverage slowly and quietly before the kids get up, going for a walk or going for a hike. Physical exercise can increase serotonin in the brain, which can also help improve mood. So the more active you can be, upwards of half an hour a day, can be extremely helpful, not only for your mental health, but also your physical health as well. Also, listening to your favorite music. If you want to experience a certain emotion, the theme of that music is going to elicit that emotion in you. So if you want to have more happiness, look for music with a happy theme. Spending time with people who also make you feel good, cuddling with a pet, using any of your senses, so what you see, touch, taste, smell, and hear, to savor something that you enjoy the smell of or the taste of, the sound of, or the physical touch. All of these are very simple self-care practices that you can introduce into your day. Relax. All right. So part of CBT, an intervention we use for depression as well as anxiety, has a strong foundational element on this belief that we have to train our bodies to relax. Because often in this busy world that we live in, just go, 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 it's as if our body and our brain doesn't remember what it's like to slow down and actually breathe. Relaxation training helps to influence not only how my body behaves, but also will influence my thought process. So regular relaxation of the body not only allows you to become more mindful of when you're experiencing tense muscles or feeling on edge, but it also provides your body the opportunity to reduce any physiological arousal and somatic complaints. So this is that physical pain in our body that is coming from that anxiousness, that can be coming from that stress. It's really helpful for reducing a racing heart, sweating, headaches, nausea, backaches, muscle aches, diarrhea, just a couple to name a few. Some examples of relaxation training: deep breathing exercises, progressive muscle relaxation, guided imagery, practice of mindfulness, tip skill, which involves changing the temperature of our body, intense physical exercise, and progressive muscle relaxation. Very, very effective in reducing anxiety as well as panic. Intense physical exercise, which I've mentioned here, the relaxation component you can pick from the deep breathing exercises, the progressive muscle relaxation exercises, guided imagery, or practicing the mindfulness. It's all very effective. So when we think about the CBT, essentially what it's doing is it's challenging a lot of cognitive distortions that can come up when we're not feeling well. Our thoughts are absolutely influential on how we feel as well as how we act. In fact, according to CBT, the first thing that will change within us prior to experiencing an emotional response is that of our thoughts. So before you notice a feeling change, the first thing that's actually changing in you is your thought process. When we are experiencing an intense emotion, such as anxiousness or low mood, our thought process may be influenced as well, resulting in impacting not only our judgment of ourselves, the situation we may be in, but also others. When we are experiencing anxiousness, when we're feeling on edge, it's very important that we first take steps to relax our body so that our mind can follow. Body and mind are absolutely connected. They influence one another, both positively and negatively. Once our body's calm, we can ask ourselves if the thoughts we are having are realistic or if there's any possibility it's being influenced by this emotional reaction I'm having right now. Looking for proof or evidence of our thoughts is a core strategy within CBT, an essential healthy coping strategy when feeling anxious or low. A little bit more about mindfulness. So mindfulness is the act of being fully present, and it's become very popular within our society and within the mental health field. Dialectical behavioral therapy, or DBT, utilizes the practice of mindfulness skills as a healthy way to cope with a wide range of struggle. Mindfulness is practiced by observing, describing, and participating in the present moment. Observation using our senses can be extremely powerful and act as a way to not only tolerate distress, but also reduce experiences of anxiousness, worry, panic, low mood, and emotional dysregulation, or feeling as though our emotions are in control of us rather than us being in control of our emotions. Very simple practice exercise that you can take home today. Self-soothe using your senses. So using your senses, you can pick one item. It can be absolutely any item. It can be that piece of paper that's sitting in front of you or that pen that you were taking notes with. And you can observe it and describe it for just 1 minute. So what you're doing is you're looking at that object and you're describing all the little details that you're noticing. Does it have a sound? Does it have a certain texture to it? Is there any temperature changes? Does it happen to have a little bit of a smell? When you're spending that 60 seconds of mindfully observing that item, every time your mind wanders, which it absolutely will do, I want you to just label it as a thought, because that's exactly what it is, and bring your focus back to that one object that you are observing. Every time you bring your mind back, this is you being mindful. This is you training your brain to be present focused. One more skill here that is very simple, very effective. Again, using your senses. So what we have here is a list of different sensory focus skills and strategies anyone can use. What you see, touch, taste, smell, and hear to have a more mindful evening, a more mindful day, a more present focused brain, rather than worrying about the future or beating yourself up emotionally for about something from the past. So using our senses is incredibly effective. We have some examples here for sense of smell, aromatherapy oils, finding a really nice scented candle that you enjoy, doing some baking. As far as sense of sight, reading a good book, looking at pictures from a previous vacation perhaps you were on that you absolutely loved, looking for images of a new travel location that you would like to go to. For a sense of hearing, listening to music that you love, listening to perhaps calming and soothing sounds. This can be anything from the sound of waves crashing on a beach, to instrumental music, to your favorite pop star that you like to listen to on the radio. We can do all of these activities, paying attention to the detail, and be very mindful while we're practicing them. And last but not least, I wanted to provide everyone here an opportunity to look at some of the local resources that I was able to find specifically in the BC region. So if anyone's struggling with anxiety, regardless of province that you live in, Anxiety BC is an absolutely phenomenal website. It has information from how can I challenge my own worry thoughts using CBT, how can I support my child, how can I support a loved one. Has great resources on there as far as free apps that can also be incredibly helpful. I was also able to find, specifically for the BC region as well, some information around adult mental health services as far as where you can find supports if it's needed, including the Canadian Mental Health Association. And there is also at the bottom of the screen information on a local 24-hour day, 7 days a week crisis line. So in the event if anyone was needing to talk to someone immediately, on the other end of that phone is usually a therapist or a social worker who can provide that support as needed. Thank you so much, everyone, for coming out tonight and listening to this webinar. It has absolutely been wonderful. And Amanda, I'm going to pass the phone call back to you.
Awesome. Thank you so much. That was really lovely. I'm going to send out these resources to everyone that signed up for the webinar. You'll get that with the recording of this webinar as well. Just so everyone has access immediately to these amazing resources. I'm going to switch gears here, and before we get actually too much into nutrition and mental health, which I'll touch on in a second, I did want to bring up some big points that I loved in Andrea's presentation. The first one being self-care. Like I love how you're talking about just keeping it small, like starting with 5 minutes. And the thing is, like, the reason I love that is because it's doing it every day that's really powerful. So it's more powerful to do self-care for 5 minutes every single day than 4 hours once a month. It's more powerful to do it every day. So that was the one thing I really loved. The other one was the breathing techniques. Because it obviously doesn't cost very much money to work on some breathing techniques. And it really does help you to take you out of that moment and to be more mindful and to pull you back into the present, which I think is a huge coping skill, especially for people suffering with anxiety. And the other thing was just how your thoughts becomes your feelings, which influences and becomes your behavior. So I love how it really does come down to the thoughts that you're thinking every day. Um, so that was really cool. I really love that about your presentation, and just really how we can use all of our senses. Um, and I loved all those little self-care activities that have for each sense. That was really powerful. So yeah, beautiful presentation. Really, really, really helpful. Um, and I hope everyone on the call is feeling the same. And now we are going to get into nutrition and mental health. So about 10 to 20% of the population experience mental health conditions each year. So that includes depression, anxiety, bipolar disorder, schizophrenia, post-traumatic stress. And research is really showing that nutrition can influence mental health. So according to a published review of nutrition and mental health, the most common nutritional deficiencies seen in patients with mental disorders are of omega-3 fatty acids, which we're going to talk about when we talk about food, B vitamins, minerals, and amino acids that are precursors to neurotransmitters. So, although the connection between nutritional deficiencies and physical illness is better understood, fewer people are aware of the connection between nutrition and mental health. So, many dietary patterns that precede depression are the same as those that occurred during depression. So, these may include poor appetite, skipping meals, and a dominant desire for sweet foods, aka your sugar cravings. So, nutritional neuroscience is an emerging discipline shedding light on the fact that nutritional factors are intertwined with human cognition, behavior, and emotions. This is not meant to imply that a particular nutrient or nutrients can cure or prevent all mental illness. Of course, that's not what I'm saying, but simply that there is a connection between mental health and many nutrients, including carbohydrates, proteins, omega-3 fats, B complex, vitamin B12, folate, calcium, chromium, iron, selenium. Like there's so many, right? It's all these trace minerals that we need for better health physically and better mental health. So good nutrition is going to obviously play a significant role in your overall brain health, and poor nutritional status may negatively influence brain health, mood, and depression, etc. So just a note before we continue, discontinuing appropriate medications or therapies is not recommended without specific advice by a health professional, but making sure that you get all the nutrients you need to support mental health is always recommended. So of course, I'm not saying that by taking nutritional supplements that you won't need any of the therapies that you're currently getting. Of course not. This is something that you're going to do in addition to what you're already doing. Um, and so I'm wondering if anyone on the call has heard of food energetics. I'm sure we've all heard the saying, you are what you eat. And that's kind of what food energetics is talking about. So by looking in nature, we can notice characteristics of the plant, and we can actually learn how the plants will benefit us. So I'm going to walk us through two examples here. The first is leafy greens. So in nature, they breathe in opposition to our own lungs, and they have veins that take the nutrients from the soil by their roots and transport them out into their leaves by those said veins. So this would mimic how leafy greens react in our bodies, so by improving our respiratory and circulatory system. Another example are root vegetables. So sweet potatoes, Jerusalem artichokes, beets, carrots, radish, the things that grow under the ground. So they really absorb all the nutrients and minerals from the soil, and they're going to store it, as well as centering and grounding the plant. So for example, in very windy conditions, the root vegetables are going to stay in the ground a lot easier because of their huge roots that are binding them down into the ground. So that characteristic is therefore going to work the same for us. So by absorbing and improving function in the small intestines, where we absorb our nutrients and thus leading to improved digestion, as well as having a grounding and centering effect. So the foods that we eat, that's going to make us feel tense and anxious. That's obviously what we want to avoid. And those are going to be the processed, refined foods. And I'm talking about sugar, alcohol, drugs, caffeine, heavily processed foods, microwave foods, and factory farming foods. So when the animals or vegetables are grown under stress, the idea here is that you will be taking on that stress energy. And the foods that will make us feel more connected and harmonious are organic, whole foods that are local and seasonal, especially from a home garden and or home cooked. So when we're thinking about foods to avoid, especially when we are in the process of healing from anxiety and depression, it's really about getting out the crap. And what I mean by crap is carbonated beverages, refined products, so like sugar, refined flours, artificial ingredients, and processed foods, so heavily processed foods. Okay, so now I want to talk about what to eat for anxiety and depression. So obviously, I believe that working through anxiety or depression, it's not an overnight solution. There's not one thing that we can do that's just going to heal it all right now, unfortunately. And I understand that it cannot be healed solely by food alone. I totally understand that. However, I do believe that what you're eating is certainly affecting your mood, and eating a healthy diet is the easiest and quickest thing you can do to feel some relief. So that's something that you are in control of. You decide what you put in your body. So that's really why I want to focus on these 10 simple foods. I've made a list of 10 foods here, and this is what you can include in your diet right now. All these foods are proven to ease stress, promote well-being and calmness, and nourish your brain. So the first one, omega-3 fatty acids. These are our brain foods. So we're going to see this in oily fish like salmon, herring, sardines, mackerel, and trout. They're also in our vegetarian options, which are flax seeds, chia seeds, hemp seeds, seaweed, mustard oil, beans, winter squash, leafy greens, and the cabbage family. Now, for those of us that don't like fish, or maybe are not eating enough fish, I do want to quickly pause here and talk about a fish oil supplement. So for those of us that know that we're not getting enough oily fish into our diet, this can be a really great alternative. When you are looking for a fish oil supplement, they're definitely not all created the same. So I'm going to give you some guidelines of the things that I would definitely recommend looking for. So the first one is that it's high quality and it's ultra pure. You're looking for advanced and guaranteed levels of EPA and DHA. So those are the two long-chain omega-3 fatty acids. That's what's important for the memory, learning. That's what supports our cardiovascular health, immune health, and joint health. The other thing you're looking for is free of harmful contaminants like mercury. The best way to know that that's happened is from a double distillation process. So that's what you're going to be looking for when you're looking for a fish oil supplement. And a bonus is if they have additional vitamins D added into the supplement. So this is just really deficient in everyone's average diet. So unless you're eating an above average diet, you are probably lacking vitamin D. So that's what I would recommend. And in the email you get after this recording, I'll send you some details about more on fish oils, and if you are interested in learning more about that. The second food to get more of is avocados. So they're really going to help that oxidative damage. They also contain lots of B vitamins, beta carotene, vitamin E, and actually the most folate of any fruit. Next are berries. So these are high in antioxidants. They're linked to sharper cognition and lower stress levels. And another food to eat for anxiety and depression is cabbage. So it contains vitamin C and folic acids, which protects against stress, and it's a good source of blood sugar stabilizing fiber. And if you want to amp up your nutrition of your cabbage, I really recommend trying out raw sauerkraut. So the process is really easy. I'll give you like a brief description, but I just Google how to do it. It's super simple. Basically what you're doing is you're doing a raw fermentation, lacto fermentation it's also called sometimes, and you're going to cut your cabbage. You can use a mandolin or a knife and just cut it really thin. And then you add some salt in, and you're going to keep squeezing the cabbage, roughing it up with your hands in a bowl. And as you do this, there's liquid that's going to come out of the cabbage. The cabbage will get all shiny. And this is actually its own brining solution. So as you squeeze and squeeze your cabbage, then you're going to pack it into a mason jar. You don't want any air, like pack it really hard in there, and then top it up with the liquid. So that's come out of the cabbage from you squeezing it. So you want to make sure that all of your cabbage is submerged under that liquid, and then you just let it sit in a dark counter. So you can let it sit for a few days or up to 28 days, like a month. You can just test it and see how you like it. If you like it more sour, let it sit. If you don't, eat it sooner. And then once you open it and you're ready to eat it, you put it in the fridge, and it can last in the fridge for weeks. It lasts for a really long time. So this is alive. It's the same idea as yogurt. You're getting those probiotics, except that it's raw. And cabbage is just so great for anxiety and depression. It helps with, like we talked about, protecting against stress. And when you ferment it, you're getting even more nutrition out of it. So that's a really great thing to do with cabbage. Number 4, so garlic. So that is what's going to neutralize free radicals. It can even reduce damage caused by free radicals. And you want to make sure you can saute this in broth and not oil. The whole idea here is that we do eat a lot of fatty food, which is definitely not on our mission for healing anxiety and depression with food. We're more in the plant-based whole food route. And I think a lot of times we don't realize that anything that you are frying, you can fry with water for the most part. So when you're frying up your vegetables, or if you're frying up garlic before you make a stir fry, let's say, you actually do not need to use oil. So that's why we're just talking about here is trying to use broth or water just to cut down that fat. Number 5 is green tea. I'm sure we've all heard this one before. So it contains an amino acid that's going to actually protect against some types of cancer. It also enhances mental performance. Spinach has a great comforting effect. Not a lot of people know this, but it is absolutely true. Lots of magnesium. That's going to help to regulate cortisol, which is a stress hormone, and promote feelings of well-being. Number 7, oysters. So this is the mother lode of zinc, and zinc plays an important role in the brain by modulating stress. So that's why oysters are on this list. GABA is an amino acid that works in the brain like the main down switch. It slows the brain down out of the anxious state. You can find this in kefir, kimchi, and oolong tea. So kimchi is basically just like sauerkraut, except it's spicy and it's got different kind of vegetables, daikon radish, carrots. They're going to have chilies instead of sauerkraut that's just cabbage. But it's the same idea. Kefir is a fermented yogurt or milk beverage. So it's the same idea as yogurt, kind of. So lots of good probiotics there. And oolong tea, obviously, is a tea. Number 9 is oatmeal. So a complex carbohydrate causes your brain to produce serotonin, which has antioxidant properties, soothing feeling, and helps to overcome stress. Chamomile tea also promotes sleep. It relaxes the mind and body, soothing, and there's more evidence than ever that chamomile calms. And the other thing I kind of wanted to just touch on quickly was megadoses of nutrition. So as we're talking about these foods, here, I can go back so you can see them. Okay, so as I was talking about these foods, like berries, if we're looking at the omegas, there's flax seeds, chia seeds, hemp seeds. Like when I'm seeing that, I am seeing an amazing smoothie. So when I talk about megadoses of nutrition, they're basically add-ons. So what can you add on to the food that you're already eating to just amp up your nutritional value? So basically, a lot of people understand money here, so I'm going to use this analogy. So if you were to have maybe a strawberry and banana smoothie, and let's say you are using water, ice, banana, and strawberry. Let's say that smoothie's nutritional value is worth $10, just say hypothetically. When you start adding in those mega doses of nutrition, you can take the nutritional value from $10 to $10,000. That's kind of what I'm talking about, mega doses of nutrition, the things you can add in that's going to amp up the nutrition. So in terms of what to eat for anxiety and depression, this is a really great way to look at it. Let's look at this list. So you can add into a smoothie, you could add chia seeds, flax seeds, hemp seeds. You could add in some spinach. We can add in the berries. Avocado, that's another one that was on the list. And now we've taken this smoothie and we've amped up the nutrition, especially for anxiety and depression. So that's a really cool way to look at that. And then in terms of teas, like think about chamomile, oolong tea, green tea. Kombucha is another great beverage. That's a fermented tea beverage. Lots of probiotics, really good for gut health. And yeah. So before we end our call tonight, I just wanted to open up the phone for any comments, any questions, anything anyone wanted to share, things that are coming up. We'd love to hear from you. So we will hop back over here and see. Okay, so no one's hopping to ask a question. That's cool. If you have any questions, you can always shoot us an email after. And Andrea, I did have a question for you actually. I was curious, I know I do have a lot of moms on this call, and I've been getting texts about this. Um, are these coping strategies something that would work also for postpartum depression?
Absolutely. So when we're doing an intervention for postpartum, we are taking a similar approach for CBT. Self-care absolutely is essential for sure. Using any of your senses absolutely can be beneficial as well. And of course, seeking out support, connecting to someone, if you're requiring additional support, whether it be through a family physician, local community center, there's lots of resources that are out there, and all of the skills that I talked about today would absolutely be beneficial for you as well.
Awesome. And then I just got a question from someone that doesn't want to ask it, but I'll ask it for them and we'll leave their name out of it. Just they're wondering, for someone that is suffering heavily with anxiety and depression and they're feeling like it's hard to make any step forward, what is the best way to start with self-care when they're like not doing any of it, I guess, is what I'm figuring.
So when we think about self-care, we want to set realistic goals that are achievable and obtainable. We don't want to have anybody set themselves up for failure. We want to set ourselves up for success. So if I'm not practicing any self-care right now, then let me create a goal that is realistic. So maybe the idea of 10 minutes a day is just not realistic because of where I'm at in my life. So set a goal where you have 60 seconds. 60 seconds a day where you do one thing for yourself. When we think about behavioral activation, physical activity is hugely, hugely helpful for anxiety or depression, but it might not be realistic to have a goal of half an hour a day. So make a goal, 10 minutes a week. 10 minutes a week, I will try and get out of the house, go for a walk around the house, or even find a video on YouTube to get my heart rate up, some form of physical activity. We really want to set ourselves up for success versus failure.
No, I love that. And that's definitely when I'm working with my clients through nutritional coaching, that's something I really focus on is I call it crowding out. So instead of focusing on what I'm not going to do, the things that I can't eat, I'm focusing on getting more of the good food in, and naturally that's just going to crowd out the maybe food that isn't as healthy, those options. And I love that what you're talking about there, just like starting really small. If it feels like it's too big, make it smaller, because the more success that you have is just going to lead to more positive things happening. Doing something positive on purpose is going to create more of that, I think.
Absolutely.
Awesome. Did anyone else have any questions? You can type them in the chat, or we'll give a minute here to see if anyone has any questions they wanted answered. Oh, I'm getting one here. Talking about on my phone. Okay, we're talking about mega doses of nutrition. Oh, sorry, we have another one here. Okay. I think Kate is unmuted.
Yeah, can you hear me?
Yeah, we can hear you.
Okay, so my question would be like, what would be some strategies for when you feel resistance, like you want to do self-care, and you're feeling that resistance? Do you have any like suggestions on maybe like mantras or something like that that could help like break through that resistance?
Thank you for the question. So I think that is a very valid question, and it is one thing that I'm presented with on a daily basis. So often what people will say to me is, Andrea, it's great that you have these strategies and skills, but when I have no motivation and no desire, or it's very hard to find the motivation and the desire to do this, what do I do? And one strategy that actually is quite effective, it's called opposite action to the feeling, okay? So what I mean by that is when the feeling is saying, you know what, don't do it. Don't do it. It's going to take too much effort, too much motivation, just too much for you to do. Ignore it, do something else. I want you to think about what the opposite action to that would be. Usually, okay, so if it's self-care, some form of activity of some sort, the opposite action, rather than giving in to that feeling of doing nothing or avoidance, is to try and push ourselves into doing that activity. And if we experience that hesitation, asking ourselves, what's the fear? Because in most situations, not all, but in most, it's some form of fear about doing this new thing or trying this thing. Whether it be that little voice in the back of our head that says we can't do it, it's not going to work anyways, it's not successful. It's usually some little challenge, some little cognitive voice that's trying to convince us why we shouldn't be doing it. And what I would do is, once we figure out if it's fear that's doing that talking, challenging it and reminding ourselves, what's the worst thing that would happen if I did push through and I practice this self-care? Realistically, what sort of experience am I going to have? And from there, I would say a lot of the individuals I work with, a lot of my patients say that they're able to push through it then. And then once we do it one time, it's not so difficult the second time. And then by the third time, it's a little bit easier and a little bit easier. And we can start to incorporate it into our daily routine. And with time, it usually becomes a practice that we begin to master. And then before you know it, a couple weeks in, it's just a part of our daily lives.
Yeah, I love that. That really brings me to the next question, actually. It's perfect. Someone just asked me about negative self-talk. So I'm going to I'll explain kind of what I typically do with my clients. And I'm super interested, Andrea, to hear what you have to say, but it fits right in with what you're saying. So basically, when I'm working with busy moms and we're dealing with negative self-talk, so that's that when you're, not being very nice to yourself in your head, those negative thoughts that you have, and they actually happen pretty frequently. The first thing we do is to notice when you're saying it. So notice every single time that you're saying something negative about yourself. And then is how I typically help people is to, one, realize you're doing it, so be aware. Two, is to say cancel that or delete that and then replace it with a positive opposite and then move on and let it go. Like, don't judge yourself for being harsh on yourself. So for example, let's say someone says, like, I can't do this, I don't want to go out in a bathing suit, I look fat, like all these negative self-talk items. One, notice when you're saying it and then say cancel that and replace it with a positive opposite. I'm beautiful, I look absolutely stunning, I can do this, I'm ready to go to the beach, I'm going to enjoy myself there. So by switching that programming in your mind, and I think that the more that you notice how often you're doing it, A, it will be surprising, and B, will actually give you more leverage to be able to start that process of changing your thoughts. But I'm really intrigued, like, what are your insights on negative self-talk and how do you work with clients to reprogram their thought process?
Very similar to what you're already doing, Amanda. So when we think about CBT, it's partially developing awareness that thought is happening, figuring out, okay, is this thought truthful and realistic, or is this my worries or my fears that are doing some talking? That cognitive distortions, negative self-talk, whatever you want to label it as, it's the same thing. Whether you have a formal diagnosis or not, this is something every individual on the face of this earth at some point in time will experience. And then what we're doing is we're replacing that negative self-talk or that distorted thought with one that's more truthful and realistic. And essentially what happens is every time you catch it, every time you are aware and you challenge it and you remind yourself of a thought, just like you said, Amanda, of something that's more realistic and more truthful, you actually can start to rewire your brain so that that automatic assumption you have about yourself in that bathing suit with time on a consistent basis, you can actually rewire your thought process so that when you have that bathing suit on, you don't automatically have that belief. Instead, you land on a belief that you truly, truly, truly believe about yourself, that it's based in truth and is an accurate reflection of yourself. So I think that our approaches, Amanda, are very, very much in line. I may call it CBT, you may call it something else, but at the end of the day, it's getting everyone to the same goal, which is a thought that is realistic, not being fueled by fear, and is just much more healthy and much more happiness for us.
Awesome. Love that. And it is so true. Like, it definitely takes time. It's not an overnight solution for sure, but having gone and done a lot of this work myself, I can say absolutely it works. And it's a process and it's something that you're going to have to be used to working on. But I think nothing feels better than feeling good on the inside, you know? Like, I think that it's so hard to be struggling with something and feeling alone. And that was the whole point of us creating this webinar today. It was just so that everyone on this call knows that you're not alone. We all deal with these things. It's super common, you know, and that there's people to help you. Like, I'm here, Andrea's here, you know, that's an email away. You know, you can hop on a call with us, like, we're here. Um, so I would really recommend everyone that's listening to this recording that is here with us live tonight. Thank you very much, everyone, for joining us. Like, super huge. I'm glad that you guys took this time out of your schedule to be with us. And yeah, and ask those questions and get some support. And just to see that there's tons of holistic things. There's lots of interventions and coping strategies and treatments that you can do that cost very little to no money. There's things that you can do at home just so that you can feel some relief and that you don't need to struggle in silence. This topic is really dear to my heart, having been someone that used to suffer from panic attacks and anxiety attacks, whatever you want to call them. I'm with you. Like, I know how hard that struggle is because I've been there. And obviously, Andrea does too. This is what she does every single day. Like, she's a leading expert in this field. So I'm so honored for her to be on this call with us and sharing her wisdom and enlightening us on so many amazing practices and things we can do at home. So thank you, Andrea, so much. I'm really, really grateful for you being here tonight. And everyone on this call, thank you so much. You can look forward to this recording. It will be hitting your inbox tomorrow. And if you have any questions, comments, concerns, you don't want to ask them in this call, feel free to email us after the email. And yeah, I don't know if Andrea, if you had anything you wanted to close up with, but
I just want to say thank you to everyone who was able to join us this evening. It has been an absolute pleasure to be able to speak. And as Amanda had said, you know, there's lots of supports out there for everyone from a mental health standpoint to a nutritional standpoint. Please reach out to Amanda and I. We'd be more than happy to be supportive in any capacity that we can offer. And I hope that everyone takes care of themselves, not only just this evening, but always in making yourself a priority. I think that's very important.
I couldn't agree more. And so everyone, I hope you have a glorious evening wherever you are in the world. We've got people from all over on this call. It's pretty cool. And yeah, I look forward to chatting with everyone in the future, and we will stay in touch. If we have any more webinars like this going on, we'll make sure we reach out to you so you can stay in touch with us. And yeah, hopefully everyone has a beautiful evening. And I really hope after this call, everyone can just take 60 seconds and do some self-care, just 1 minute after this call. That would be amazing. So yeah, I hope everyone has a lovely evening, and we will chat with everyone soon. Bye.